welcome to the channel. Thank you so much for clicking on today's video. I'm very excited about the topic. But before we get into the video, I had two announcements that I wanted to make. The first thing is, if you do watch these videos and you like to see the chat on the side and you think to yourself, man, it would be really cool to be part of that chat, I would love to have you. I stream on Twitch, which will be the first link down in the description. I stream every Monday, Tuesday, Thursday, and Friday at 1 p.m. Pacific Standard Time. So if you're ever, around that time, if you're ever kind of bored and you want to hang out, I'd love to have you. It's a really, really good time. At least I think so. And also, for those of you guys that missed the vlogs, or those of you guys that are curious about my triathlon training and how it's going, I have been vlogging very, very frequently on the second channel. So that'll be the second link down in the description. So if you're someone that enjoys watching the vlogs, you missed those vlogs, there will be a link to the second channel. I will be putting up a video the same day as this video is going out, so I would love to have you come and check it out. But without further ado, let's get into the rest of the video. Guys, gals, non-binary pals, we have a fun video today from our handsome young Dr. Mike. Well, he's probably older than I am. I don't know. He might be younger than me. That would be pretty crazy. So today, we are going to be talking about the video titled "Doctors React to Controversial Cosmo Cover." Now, I've already talked about the Cosmo cover, so it's something that I've talked about before, but I'm kind of curious to see what he has to say, and I know he actually has another doctor on, and they kind of speak about it. So I'm just kind of curious as to if they think the same way I do, or if maybe I disagree. So let's see what good old Dr. Mike has to say.
Cosmopolitan UK put this on the cover, and it stirred a lot of controversy.
But let's focus on whether obese people are healthy, because they're not.
I sat down with Arga Gonzalez, a renowned bariatric surgeon and obesity researcher, to get her thoughts on the cover, as well as the popular body positivity movement known as health at every size. Do you think overall the health...
Okay, so it seems like this is more of an interview almost, and he used the cover as a little bit of a clickbait. Hey, do your thing, Dr. Mike. I see how it is.
health at every size movement is an overall net positive, net negative, or neither?
That very line, healthy at every size, is not actually true. Can there be people at any size who are healthy at that moment? Yes.
So this it says right here in like quotes, because I know so many of you guys don't actually watch these, you just listen. Health at every size principles help us advance social justice, create an inclusive and respectful community, and support people of all sizes in finding compassionate ways to take care of themselves. Quote. So that's from hazecommunity.com.
But is it true that no matter what your size, you're always able to be healthy? Like, that's not true. I am anti-weight bias, anti-fat phobia, anti-fat stigma, definitely anti-fat shaming. I've written about that, but I don't think that being aware of the consequences of obesity is the same as fat shaming.
Oh my gosh, dude. I feel like she has just explained exactly how I feel with smarter words than I usually use and much more succinctly. But I mean, I cannot express more how much I agree with what she just said. Like, that is basically my position in a very short explanation. So, I mean, I feel like this is going to be obviously a lot of agreeing, but we'll see.
What I'm hearing, and correct me if I'm wrong, is you could be a patient who is diagnosed with obesity, may have great cholesterol, may be not diabetic, their blood pressure may be great. The fact that their weight is above a certain cutoff, it puts them at a greater risk down the line, maybe not at this given moment.
All those lab values also don't mean that they don't have knee pain or hip pain or ankle pain.
Dude, this is so good. Ooh, this is exactly what I've said. Like, again, lab values aren't everything. Lab results aren't everything. And it's like, just because you feel good right now doesn't mean 10 years, 20 years down the line that you're going to feel the same. So again, I'm not saying that if you are big, we should shame you and make you feel bad about being big. But it's like, is it fat phobic to be realistic about the implications of being that size? And is it fat phobic to be like, hey, let's not do this because the data has shown that being that size for an extended period of time is not a net positive in your life?
lower back pain, which are all things that we commonly see with people with obesity, increased risk of endometrial cancer, for example, increased risk of mood disorders. Like all of that is still there, even if our lab values are normal.
Speaking about the Cosmopolitan cover, do you think that those covers send a right message or wrong message during a time where obesity in the United States and in the world is becoming an epidemic of sorts? With COVID-19, we see worse outcomes for patients who are diagnosed with obesity. Do you think those covers are problematic, basically?
I think they're a little bit misleading. I think that the story itself, like the content that they wrote, is very nice, and they talk about how each of these women, what their relationship with physical activity is, and how they feel about their health and their body, and it's not even about obesity.
Dude, this is so good. Like if you haven't seen my video where I talk about this, you're probably not going to understand any of this, because I went over the actual article and we read it and we dissected it, and my conclusion was like, this article is fine. Like it's not even really saying that being obese is healthy. Like the whole article was like showing a ton of different women and what their relationship is with fitness and with health. I just spit. And so it was like exactly what she said. It's a little bit misleading, and it 100% was a little bit misleading.
At all. There were a number of people criticizing, saying that, especially when we know that people with obesity have worse outcomes with COVID, this is irresponsible. And to me, that feels a little bit of a stretch. Like, I think they're just trying to say that people of all different sizes can move, can be physically active, can love their bodies. And I think that's a really good message.
I think they are ultimately sending the message, and I agree with you on that. I just think they're doing it in a cheeky way where they're trying to create inflammatory conversation, or maybe it's productive inflammatory.
100%. It was like clickbait. Can't hate on him, because like a ton of people made videos like, I'm so mad about this, and I was like, did you even read the article, or like, are you just mad about the cover of it? Oh, you didn't read the article? Well, maybe do a little bit more research. I don't know. Like, it's not that hard. It's literally just read the thing that it's about.
Conversation.
No doubt. I mean, they could have said, this is loving your body, or, everybody is worthy, or what, there's a number of different things they could have put on those covers that would have been pretty accurate and indisputable.
We frequently see on the cover of magazines very slender bodies, thin, muscular, six-packs, etc. It's led to true cases of disordered eating going up and body dysmorphia. The sort of rebuttal to this is to say, and that's what's happening right now, let's put people of different sizes on magazines, and let's take someone who is diagnosed with obesity and put them on a cover. Is there a chance that that can lead to disordered eating in the opposite direction, of people feeling it's okay for me to be this size, I should continue my lifestyle, not make changes, not think about going for bariatric surgery, because the celebrities I look up to are this way?
I think there's a balance there. I think that we can have the covers like the Cosmo ones and say, look, people who are a bigger size can still be active and aspire to having a healthy body, versus saying, this is how we all are and we should just live with it. I think that's a different message. In this country, about 3/4 of people have overweight or obesity. And if there were no...
I'm sorry. Like, I know that that's the right way to say it, but like, it just sounds so weird when you hear someone says like, they have overweight. I don't know. It's just, I understand why, but I'm just saying it sounds funny to me. That's all I'm saying. Okay. All right.
No negative health consequences of that, maybe that would be fine. But the fact is, as we've talked about, all of that excess weight brings with it risk for very serious problems that are costly to the individual, that inhibit their lifestyles and make it harder for them to live the life they might want.
So one of the most frustrating things that I've, like, personally with me with like the health at every size thing is like when I talk about like the life that I was living, and I understand this is anecdotal, it was my life, but from speaking with literally like hundreds of other people, maybe even thousands now, of speaking about how we were living our lives while we were, had obesity, versus what it is now that we've lost the weight. It's like, it's not just the fact that like maybe I was unhealthy. It's the fact that you feel like you are trapped in this version of yourself. And not just because society makes you feel that way, but it's like bending over to tie your shoe is really hard. Like little things like that, like getting inside of a car is really difficult. Going on a run is not possible, right? Like I couldn't do that. Like there's so many things that aren't just your lab results that relate to your size. And so that's why it's frustrating when people are like talking about this stuff. It's like, okay, I understand, like, but that's one piece of this whole, you know, for this whole pie. But like it's one piece of the puzzle, right? Like there are so many other things that go into it that's not just what are your lab results. Like there's so much more. And so that's the one that that frustrates me, because there is so much more that can be going wrong, that your size might be limiting you in your life.
I think we have to kind of acknowledge both sides of it, that no, we don't want to be stigmatizing people who are bigger, but we also want to recognize that obesity has a number of medical problems associated with it.
The way that someone like you goes about treating individuals who are diagnosed with obesity, or at least morbid obesity, would be through a procedure known as bariatric surgery, right? That is your specialty. You obviously don't think that is recommended for all patients, but it's certainly one of the best treatments out there when it comes from an evidence perspective of not only losing weight, but keeping weight off long term, and then also even getting rid of some other diagnoses like diabetes, like high cholesterol, etc. Why is it that bariatric surgery has better long-term success in keeping the weight off than, let's say, traditional diet and exercise recommendations that your family medicine doctor can give you?
Okay, I'm kind of curious to see what she says here.
One thing we know about losing weight with diet and exercise is that only about 5% of people who lose weight that way are able to maintain that weight loss. So all of us know people who've had incredible success with diets and exercise, and that's amazing, and something to be really proud of, because they've really beaten the odds. For the majority of—
That's right, baby. We're all gonna beat the odds, all right? If I can do it, you can do it. Don't let any doctor tell you otherwise, all right?
People, no matter how hard they try, it's very, very hard for them to get to a healthier weight and size on their own. And that's where bariatric surgery comes in and is really—
I need to make 5%er merch, all right? 5%. I am the 5%. That's what we're going to get it on a shirt.
really, really helpful. We don't 100% know in terms of the weight loss why it's more effective. We think that it helps reset people's kind of set point, if you will. A lot of us believe that every body wants to be around a certain number in terms of weight, or a certain size in terms of BMI. We don't know how, that develops, but that seems to be what happens. One of the most magical things about bariatric surgery is its effect on diabetes, especially when we talk about specifically the gastric bypass. We have many, many patients who have diabetes, are on insulin, maybe other medications for it.
This is a really cool little like visual of it. So basically it just like, man, that's crazy how much smaller it gets. So this is like your normal stomach, right? And this is your stomach on drugs. I'm just kidding. But this is the bypass stomach. So it basically literally just is like, skirt. Nah, I'm good, dog. That's wild.
Right. And then they have surgery today, and then today their blood sugar is normal, and they no longer need those medications. So that's really magic.
Absolutely. I mean, anytime you can cure.
Well, I mean, I don't want to say it's magic. It's surgery, right? So I kind of want to, for me, I remember when I first started my page, I know I've talked about this before, but when I first started my page, I used to make it very, very clear that I lost weight naturally. And I lost, when I first started my page, I think I had lost 150 pounds or something like that. So 150 pounds lost naturally. I was very proud of it. And as the years have gone on, I'm less and less hostile, I guess, towards weight loss surgeries. I think it's because just in general, I've had conversations with people that have had weight loss surgeries and heard their stories. My position on weight loss surgery is that, I mean, obviously for me, I was able to lose the weight naturally, without having to do anything. And I really do think that most people should try and weight loss surgery, surgically doing something to your body should be the last option. That's my opinion, right? Am I saying it shouldn't happen? No, not at all. And I know many people that have had it and have had success with it. And so I'm never going to tell someone not to do it. But I think that it really should be something you think about for a very long time. And I think like you should really believe that you can lose the weight on your own without going, to this, extreme, I guess you could call it. But I definitely have opened my mind to being more accepting. Not that it really matters, like you do your thing, but like to being more accepting of understanding weight loss surgeries and why people get them. So my views have definitely changed a little bit.
We consider to be an incurable illness, it's absolutely amazing. Talk about the challenges that your patients face, and actually my patients as well, in trying to get bariatric surgery covered from an insurance perspective. Because right now, I believe in the past you've mentioned that only 1% of eligible patients actually do end up getting bariatric surgery. Why is that number so low? Can we impact it in a meaningful way?
I think the obstacles are multiple. One is people in the past have thought that bariatric surgery is dangerous. It turns out that's not true anymore. The risk to dying within 30 days of surgery is less than it is for having your gallbladder taken out, which people do every day in this country. Another is the perception that it's the easy way out, that if you have bariatric surgery, then you have no willpower, you can't do it on your own, etc. And really, that's not it at all. I think the people who come to us for surgery are some of the strongest people, because what they're acknowledging and realizing is that they have tried all these other things that don't involve surgery and nothing has worked. And rather than just giving up, they're saying, what else is out there? What else can I do? Because I want to take control of my health.
And I personally do think that I personally do think that it's not the easy way out. And I think, like, again, for me, my mission is to help people lose weight, right? Help people lose weight and keep it off is the most important thing. And so it's frustrating to me if you are someone that is always making videos about health at every size and people just need to lose weight, blah, 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 but you're also negative towards people getting weight loss surgery. Like, what on earth is your stance here? Because if you really want people to lose weight and that's what you think needs to happen, but then you're also like, but you can't do it that way also, or that way. You can only do it this way. It's just like, dude, that's such a narrow way of thinking about things. Like, everyone has a different life. Everyone has different experiences, and everyone will find a different path. But as long as they reach the same destination, like, personally for me, that's what matters to me, right? Like, that's what I care about.
To have a healthier life. Another issue is time. I believe you would know more about this than I do, but in your office, you're the one who's seeing these patients before they come to see someone like me. And you're often managing, diabetes, high blood pressure, high cholesterol, maybe a mood disorder, all these other things. I think sometimes it can be hard to talk about obesity. And also, I think you've mentioned this in some of your previous videos, there's a lot of sensitivity around obesity, and how do we talk to people about it in a way that, is engaging and brings them to the table and makes everybody feel like we care, that we as physicians care about their health, as opposed to judging or blaming or shaming. And then the last, maybe biggest issue is insurance coverage. I believe, as many of us do, that part of the reason most insurance plans, or many insurance plans, don't cover bariatric surgery is because of weight stigma and obesity stigma, basically.
Shout out to America. Best country in the world, baby. Let's go.
People think it's not a health issue. But can you imagine if there were a plan that said, no, you can't have a coronary artery bypass graft, you have heart disease, but you're stuck. Good luck with it. It's a lifestyle you've chosen.
Not only is it beneficial to the patient very clearly, it also should be beneficial to the entire system. Because when a patient loses, a significant portion of their weight, if they're a patient diagnosed with morbid obesity, they will have better outcomes, will use the emergency room less, will be less likely to need a stent, a cardiac cath, will take less medications long-term. So wouldn't that be even a cost-effective measure for them to implement? And I don't know why it is that a lot of insurers don't look at it in that way.
Yeah, I don't totally know either. I haven't been in their shoes, but what I think is happening is an artifact of our healthcare system in this country. Basically, in our country, people change.
This is such a good, so to kind of explain that to maybe people that aren't super in the know of this stuff. So another argument you hear a lot of people that are like anti-obesity or whatever you want to call it is like they take so much money out of the healthcare system because they're always going to the doctor and they're always they have this issue, they have this issue, they have that issue, and like fat people are just terrible and they're costing the country millions and billions of dollars, right? So that's an argument you'll hear a lot. So again, why would you be against someone getting a surgery to help them lose weight and then they don't need to go to the doctors as much? It doesn't make any sense. I swear people like have arguments, but it's like some people just genuinely don't like fat people, which sucks, but I really think that that's the case, right? If your goal is to get people to lose weight, you shouldn't be against someone wanting to try every single option that they have to make that happen.
Their insurance every time they change a job, right? And sometimes even when they have the same job, there's a new election period for their benefits and they switch to some other company. In order for one company to see the benefit, that long-term benefit in cost savings after bariatric surgery, that means that patient would have to stay with them for years and years. And many patients do not. Because either they change their jobs or there's something else that they need on their plan and they switch. The only way I think we would really reap those benefits is if every plan from every insurance company covered it, and then they would all be seeing those cost savings as patients move from one system to another.
It's unfortunate that we've come to the point where we have to rely on a surgery because we don't have a clear-cut way for 95% of people to be able to lose weight on their own and keep it off long term. Why do you think that number, 5% of being able to keep weight off long term, is so low? Is it something to do with adherence to diets? Is it the lack of good information on nutrition? The fact that
I'm gonna answer before she does. I'm gonna assume she says it's probably a mixture of all of those things.
There's a level of willpower that's involved in this. Where do you think that 5% stems from?
I mean, just like anything else, it's multifactorial. There are a number of different factors involved. Like one,
nailed it.
For example, is we know a lot of people with.
I honestly should be a doctor. Everyone, I would like you to call me Dr. John from now on. Thank you very much. And moving on.
Obesity live in parts of towns and cities where they don't have access to healthy food or not easy access to healthy food. We also know that healthy food in a lot of cases is more expensive. So that means people who are making less money or lower socioeconomic class level don't have access to healthier foods. And so even if they can get by for some period of time and make modifications, there's real budgetary constraints that come into play.
How do you talk to patients that may not be candidates for bariatric surgery because you're certified in obesity medicine as well? How do you counsel those patients saying like, look, maybe bariatric surgery isn't for you. There's a 95% chance you're gonna fail in losing weight, but here's how you can be successful. Because it's a daunting task.
Man, if you, that would be the worst way. Someone's like, yeah, I want to lose weight. Okay, cool. Just so you know, 95% chance you're not going to do it. But let's talk about the things that probably not the best way to approach someone on that topic.
I would tell anybody, whether they're having bariatric surgery or not, more or less the same thing, which is that there has to be a lifestyle change. As long as we are thinking about weight loss as a diet, as a temporary thing, especially that in a way that we're going to deprive ourselves, that is not sustainable for anybody.
Facts.
The only time that you will really be successful, and this is true for those who've had surgery as well, is committing to living life a different way.
Amen. Amen. Man, 3 doctors all agreeing on things. It's a beautiful thing.
Committing to living and eating and moving differently than you did before.
There was a quote that I wrote down in my book here from your Medscape article. Someone commented, I believe it was a nurse, an RN. This person wrote, body positivity is not about health, it's about combating discrimination against marginalized bodies. And I think that's such a powerful quote. The body positivity movement should be about fighting this discrimination, not about saying that the diagnosis of obesity is a false one or a made up one or it's a judgmental one. It's an objective measure of someone's.
I think like here it's you give a mouse a cookie kind of thing, right? It's like, I agree with that, but then it's like people are trying to push it more and more and more and more to the extreme. Like, it's like, yes, I agree, but then it's like, well, what about this and about that and about this and about that and about this? And then it's like, wait, I didn't agree with all of this stuff. Like, I was cool with this thing, but now we're all the way over here, and I don't know if I'm comfortable with that. And a lot of people, like, I get messages every day of people that, like, stepped on body positivity here, and now it's gotten to here on the level of the scale, right? And now they're just like, wait a second, I didn't get on this. I got on this, and it's, yeah.
Risk and current health. Now, does it mean that you're completely unhealthy if you fall into one of these BMI categories? No, because again, spectrum. But the fact that if someone discriminates against you for being in this group, that's what body positivity should really be focused on.
I think it's like a yes and. Yes, you should feel good about your body. Everybody deserves to feel good about their body. Everybody is worthy of love. And there are negative health consequences for obesity. Both these things are true, and they are not in opposition. And anyone who tells you otherwise, I think, is stirring up trouble.
I would like for you to
I mean, that's a great answer.
have the last word. You're the expert. Tell us what message you'd like to leave the audience with.
Well, thanks, Dr. Mike. What I would say is that make sure you hit that like and subscribe. Oh, he wasn't done.
I just would love everybody to understand that when your doctor talks to you about your weight, it's most times not because they're trying to attack you, but because they want to help you. If you're not ready to talk about it, you can just say so. But keep in mind that you can always come back to that conversation. And in the end, we're all in it together to help us live happy and healthy lives.
Well, this was a really fun video. I'm glad that they made it, and like obviously I know that I was kind of joking around, having some fun, but I really do think that this is an important topic, and I personally think it is really cool that Dr. Mike is like talking about it, and he's not like letting people say that he's like fat phobic steer him away from talking about it. I think that that's a good thing, and you know, I mean, there's so many things he could talk about, and the fact that he's like continuing to talk about this, and I feel like this is what I do, right? I talk about this all the time, and so the fact that he's not 1,000,000% in this all the time, I feel like the points he brings up are things that I agree with, so I do appreciate that. But yeah, I mean, this all in all was a fantastic video in my opinion.